Welcome to Birth Story Time. It's midwife Catherine, and we're going to be talking about when midwives should use the technique that I've discovered, the Taylor technique. We use this technique when we have a delayed second stage of labour. For purposes to make life easier, in Australia, in a public hospital, a delayed second stage of labour for a woman having her first baby, so a primip, is 2 hours. And then we would make the diagnosis of a delayed second stage of labour. This is different for home birth, different for women that have had babies before, different for many circumstances. But just for purposes for this discussion, we are going to say that it is in a public hospital and it is 2 hours of pushing for a first-time mum. Before you consider using the Taylor technique, the number one question we need to ask is the fetal heart normal for a second stage of labour? If the fetal heart is not normal, then we are not doing the Taylor technique. We are escalating to an immediate obstetric review. And the next question we need to say is the head on view? Now, when I say is the head on view, I mean the woman pushes and we see the head come up, or the head is just sitting there on the peri. I do not mean when the woman pushes, we are in her vagina, pushing down on the perineum, gazing up into her, saying, oh, I think I can see the head up there. That is not head on view. Head on view is hands off. Oh, look, we can see the head. So if we have head on view, we then can use my Taylor technique, the myofascial release of the transverse perineal muscles, or acupressure on conception vessel 1, which was how, as a midwife acupuncturist, I first discovered this point. If there is no head on view, so the woman is pushing and she's in a delayed second stage of labour and there's no head on view, well, then you won't be doing this acupuncture point. You won't be using this single acupoint, because we actually need tension in the pelvic floor. We need that tension to assist with baby's head flexing. So we don't want to be releasing the pelvic floor too early. Instead, what we do, we start to use our multiple different acupuncture points. And I've called that, it's a protocol that I have developed for a delayed second stage of labour. And if you want to learn all of these protocols, and if you want to learn all about the single use also of acupuncture points throughout pregnancy, throughout labour, throughout birth, and also in the postnatal period, then just click on my link on my profile page, and that will take you to my online learning course available on Open Learning, which is a global platform, and you can do my course, which will take you about 3 months, from anywhere in the world. So you can learn a single acupuncture point, or you can learn multiple acupuncture points, as well as positioning. As you can see here, we have her with a peanut ball between her feet with the knees closed to assist with opening the outlet. And we use different points when we don't have head on view, but we have a delayed second stage of labour. So there's videos, there's tutorials, there's a very interactive course that I have developed for midwives to learn how to integrate acupuncture points with either acupressure. If you're a registered acupuncturist like me and a midwife, then there's acupuncture and dry needling protocols, and it's all in my course online.